Okay, so this is a couple of things to consider. Say you've got like low back pain or buttock pain or sciatica. Oftentimes we will do, so if it's my left side here, might try, something like this, like a piriformis stretch kind of thing, here or on my back. Yeah, that can provide temporary relief, but we should almost always check the other side too, because what you might find is that you actually might be tighter on the other side. Like say over here, when you come across, you might actually be tighter over here. And the reason for that may be that you're always skewing to that side to offload here. And so you're overloading, overworking here. It may not be painful, but it can certainly be tight. And that could be throwing things off and feeding the fire, so to speak, because you're trying to get over here to shift lift and you can't because you're always getting pulled over here by that tightness. So that could actually be making things hurt more and become painful and tight, but for a different reason. So make sure you check both. So here we go. I'm gonna lie down on my back here. And again, I can do the one that's painful. I can kind of check that, stretch that, bring that up and across, all kinds of different things here. But let me try my other side. Maybe bring that across like this. And so again, like rotating, if I think about that broad line, I'm actually turning my lower body towards that weaker side and more painful side, because that's what I'm not doing. I'm doing this already. Maybe not in the way where this is getting stretched, but I'm doing this rotation already, so this probably would feel easier for me to do that motion. So I need to look for what's tight, because I'm skewed, I'm biased in one direction. So if I come here, I actually feel tighter on this other hip, and it's like, oh, maybe that has something to do with why I'm painful on the other side. So let me work this, and then we can work that even further into a strengthening. So if I'm biasing that, I can actually do like a unilateral or single leg bridge with a slight rotation. Now make sure you're in control here. This is a little more advanced, but I can kind of come up and across, and I can use both arms here too to stabilize. And I'm just going to come up with a slight little twist from my broad line, so it's controlled. I'm not doing this from my low back, but I want to come up in there. So I'm lifting, driving my right side up and forward and across, rather than just straight up. Now this is the easier one. I could start with that, but I can also use my right leg here to push down to my left and actually better anchor my weaker leg, and I actually will feel stronger because it has a little assistance. And I get more feedback in my glute here, and I'm less likely to get a hamstring overload or hamstring cramping here because I can better control it. Maybe I'm getting more of a stretch here too because I can use my right leg to help stretch that. So I can actually get a lot of benefit from doing that while I'm simultaneously kind of stretching that right side, and I can skew more into that. As long as I'm not collapsing my left or having pain, I can kind of feed that a little bit more and work in that direction as I'm skewing the opposite direction, like towards my painful weak side, because that's what my brain has been avoiding, which is actually getting me in trouble to begin with. And that's where you can progress that.